Hey everybody, thanks for joining me again. My mission is to educate and spread awareness through this channel. The information contained in this video is of general nature and does not constitute medical advice. Talk to your doctor for your individual circumstances. Do not forget to hit the like and subscribe button at the end of the video. This week we will learn about the flu. Influenza is a contagious respiratory infection caused by the flu viruses that travel through the air and enter the body through your nose or mouth. The flu is a contagious disease and it can cause mild to severe symptoms along with life-threatening complications, even in young, healthy children and adults. Flu season starts in October and can go as late as April, but it usually peaks in the U.S. in February. Public health officials are reminding everyone to get a flu shot as cases have rose up and because of the severity of the novel coronavirus. When someone with the flu coughs or sneezes, droplets carrying the virus travel through the air, and whoever inhales these droplets in their nose or mouth will possibly become infected. You can also contract the flu virus if you touch contaminated items like doorknobs, keyboards, or desks, then touch your nose, eyes, or mouth. People with the flu can spread the virus a day before their symptoms even start and up to 7 days after you become sick. If you contract the flu, you are most contagious the first 3 to 4 days. Flu symptoms: fever or feeling feverish, achy muscles, especially in your back, arms, and legs, runny or stuffy nose, sore throat, cough, chills and sweats, weakness and fatigue, headaches, vomiting or diarrhea. Warning signs that you may be getting serious flu-related complications, which can be deadly. In children, those are fast and troubled breathing, bluish skin color, severe crankiness, fever plus rash, lack of interaction, not drinking fluids, symptoms that improve then return with a fever and a worse cough. In adults, breathing troubles, pain or pressure in the chest or belly, dizziness or confusion, sinus or ear infection, pneumonia, bronchitis, asthma, inflammation of your heart, brain, or muscle tissues, multi-organ failure, sepsis, which is a life-threatening response to infection, worsening of condition such as a heart disease. If you have the flu and fever lasts more than a few days, or if you experience difficulty breathing, chest pain, persistent cough, mucus, weakness, or feeling lightheaded, get medical help immediately. These are signs that the virus is not getting better and you may be developing a complication. Influenza risk. People at risk are those older than 65 years old, those living in a nursing home or long-term care facility, those that are pregnant or up to 2 weeks postpartum, those who have a weakened immune system, those who have a chronic illness, those having a body mass index of 40 or higher. People who get hit the hardest with the flu: children, older adults, pregnant women, anybody with a chronic medical condition, and healthcare workers are at increased risk of getting the flu or having complications like pneumonia, bronchitis, sinus, and ear infections. Children 2 and under are especially vulnerable to catching the flu. Babies 6 months and under are more likely to get complications because they are too young to be vaccinated. So parents, be careful who is around the baby and make sure they have been vaccinated. Age 65 and up are at greater risk, and they account for most flu-related deaths and for more than half of the flu-related hospitalizations. Pregnant women and those who had a baby in the previous 2 weeks are more likely to get ill, as opposed to women who are not pregnant. People with chronic medical conditions are at great risk of having complications with conditions like asthma, diabetes, heart disease, obesity, a compromised immune system due to cancer, HIV, or other conditions. How the flu is diagnosed. Your first step would be to visit your doctor. The doctor will complete a physical exam. You will report your symptoms, how long you had them, how severe they are, what other medical conditions you have, if you're pregnant, or if you live with anyone who is at high risk of catching the flu, and the doctor may also order some lab tests. Most common test is the rapid influenza diagnostic test, where they swab the back of your nose or throat. Then they check the sample for substances that cause the immune system to produce antibodies. The test results are usually back in 30 minutes. Some specialized labs and hospitals take blood samples and look at the DNA or RNA of the virus if it's there. Vaccines. Like all vaccines, the one for the flu isn't perfect, but what vaccines are supposed to do is cut the risk of the illness, and if the virus is caught, it helps decrease the severity of it. Vaccines are not always a good match because experts have to decide months in advance which strains to include in the vaccine. and the strains can change quickly. Two types of flu strains that infect humans are A and B. This year's vaccine has been a good match thus far and have been protecting against the H1N1 and the H3N2 strains that are circulating. The vaccine this year is considered quadrivalent vaccines, which means it protects against 2 A strands and 2 B strands. The way experts decide what to put in the flu vaccine is during flu season, they study samples of viruses circulating to find out how well the vaccine protected against those viruses. Then they use the information to help make their decisions for the next year's vaccine. It is recommended that pregnant women who get the flu shot, they should not use the nasal spray. Pregnant women who get vaccinated also cuts the chances of their baby contracting the flu because some of the protection from the vaccination goes across the placenta and protects the baby for the first 6 months of its life before immunization is recommended. The vaccination is not recommended for babies under 6 months of age or for anyone who has Guillain-Barré syndrome that should not get the flu shot within 6 weeks of any previous flu vaccination. Nor should anyone with a known severe life-threatening allergy to any of the ingredients in the vaccine get the shot. Influenza treatment. The best way to treat the flu is to stay at home away from others unless you are going to the doctor. Get rest and drink plenty of fluids. Do whatever remedies you usually do for yourself that seems effective. Or you can visit your doctor if you notice early signs to get some antiviral meds. Tamiflu is one of them. It's a 75 milligram capsule that's taken for 5 days, once a day. Relenza is a powder that you inhale twice a day for 5 days. Xofluza is a 40 to 80 milligram tablet taken once depending on your body weight. Rapivab is an IV infusion given in one dose for 15 to 30 minutes. Flu Mist is a live virus nasal spray vaccine that's approved for children and adults. Flu Mist is not for people with weakened immune systems or pregnant women. If you take any of these treatments mentioned within 2 days of your symptoms onset, they could be helpful at decreasing your symptoms and shortening the time that you're sick. You should consult with your doctor about which vaccine is better for you to take because they have vaccines approved for different age groups. They have the standard flu vaccine. They have high dose injections for people 65 years and older. Shots made with added ingredients to help trigger strong immune systems or immune responses for people 65 and older. There are shots made with the virus grown in cell culture, not eggs, for people who have allergies. And there are shots that do not use the flu virus and are made using a different technology. Influenza prevention. The single best way to protect against the flu is getting the flu vaccine if you are 6 months or older. It is also important to get the flu shot every year. Wash your hands, use soap and warm water, scrub for 20 seconds or more. When you can't use soap and water, you can use 60% alcohol-based hand sanitizer. Cover your cough. Cough or sneeze into a tissue and deposit the tissue into the trash. If you don't have tissue, cough or sneeze into your elbow. Avoid crowded areas. The flu spreads easily in crowded places like public transportation, schools, and offices. Stay home at least 24 hours if you have a fever. Do not touch your eyes, nose, or mouth to avoid germs entering your body. Clean and disinfect surfaces and objects like keyboards, doorknobs, and telephones that may be contaminated with germs. This has been your host, Imani. Don't forget to hit the like and subscribe button. As always, stay safe and be aware. Spread love. Thank you for your love and support on my endeavors. Until next time.